This program is brought to you by Emory Healthcare.
During treatment, patients experience common side effects such as urinary symptoms, going to the bathroom more often. Urgency is when you got to go, you really got to go. And sometimes they'll have loose bowel movements or just irregular bowel movements, and fatigue. These are the most common things patients under treatment experience. During treatment, we meet weekly, we talk about these things, and usually we have pretty simple answers for it to keep you going. And it's rare that people really slow down, and we don't put any limitations on you. Once you finish treatment, our plan is to meet you usually within the first 4 to 6 weeks afterwards. And most of the time, these symptoms have gone away. If they haven't, then we come up with a plan how to address them. So one of the last things that comes back to patients is their energy. So the fatigue that people experience can be pretty extreme, and it just takes some time, but universally it comes back in 4 to 6 weeks and you're back doing everything you anticipated before. You usually see your cancer doctors 2 to 3 times a year, even in the best case scenario where you're free of disease and you have no side effects. And we do that for years and years so we can follow you. We're still a part of your team. We need to know what the success of your treatment is. We follow all our patients, not just a few of them. We have a database that includes everybody. Say 3 or 5 years after treatment, the kind of things that prostate cancer patients face are changes in their urinary function, not incontinence like leaking or anything, but maybe going to the bathroom more at night, going to the bathroom more during the day, not being able to hold it as long. Some bowel irritability would be bad. Kind of a worst case scenario is bleeding from your bottom, and this happens very rarely. And if it does happen, we take a look and see why, and there's usually a simple solution for it. And then sexual dysfunction. That is one of the most common things that happens with prostate cancer treatment, whether it's surgery or radiation, just with aging, and we have an erectile dysfunction clinic that helps address these issues. One of the key things is exercise. We know very well, and this is well supported in the literature, that just exercise every day reduces the risk of cancer recurrence, especially in prostate cancer. And so we talk about just little measures of getting out and exercising every day. And some people can't do traditional exercise, so we figure out how they can best exercise, whether it's getting to the pool, just doing calisthenics in front of the TV, or just opening up the front door and walking 10 minutes a couple times a day. That's really what we're asking them to do, and so we help people develop a program for that. And then also diet. Diet is very important. A lot of people say, well, I've been eating this way for 40 years, what's it going to do to change now? But that's not entirely true, and we know people that eat more fruits and vegetables in their diet and limit more of the bad things are healthier, and they have less chance of cancer recurrence. And so we counsel people on these measures especially.
The preceding program is copyrighted by Emory University.